Okay.
Welcome to Brookdale Briefings. I'm Eitan Diamond, Director of International Communications at the Myers JDC Brookdale Institute, and today we're here with Dr. Bruce Rosen, Director of the Smokler Center for Health Policy Research at the Institute, and we are discussing a new publication on the Israel healthcare system put out by the European Observatory on Healthcare Systems and Health Policy. This was authored by Bruce along with his colleague Ruth Waitsberg. So let's start off by telling me a little bit about what's so interesting about the healthcare system in Israel.
What's drawing so much international attention, Eitan, is that the healthcare system in Israel is so efficient. In terms of cost, we're among the lowest cost healthcare systems in the developed world. And yet, when it comes to the outcomes, like life expectancy or infant mortality, we're among the best. People are wondering, how do they do it? How do they get those good outcomes at such low cost?
Well, I would think some of it has to do maybe with the startup nation. There's this image of Israel as a high-tech powerhouse. Does that play out in the healthcare sector?
Absolutely. You know, for many years, Israel has had electronic health records for all of its primary care physicians, probably among the first countries in the world to do that. In recent years, we've taken another step forward and hooked up the information between the hospitals and the primary care, so that if someone comes to the hospital even unconscious, the emergency room physician can immediately pull up their chart from the community and know if there are any allergies or sensitivities that he needs to take into account. And the next step is going to be, and we already have some important starts here, are to use video conferencing to provide care within the home for frail elderly while the physicians and nurses are sitting in their offices.
So this would have a good impact on the quality of healthcare?
Oh, absolutely. It's been vital. A very important part of the quality in Israel has been the electronic health records. In terms of quality, recent studies have shown that even though we're spending much less than the US, our quality of care is as good in the community and is improving more rapidly. Part of that has to do with the structure of our health systems, but part of that has to do with these electronic health records and other information technologies which make it easier for the doctor to give good quality of care. In fact, the OECD just did a report about quality of care in the community in Israel, and it said that it is among the best in the world, with the electronic health records being an important part of that.
Now, the book talks a lot about a number of reforms that are underway, the big systemic changes in the healthcare system. Tell me a little bit more about those reforms.
Yeah, we're in a period of really rapid reform. Now, we've had a good system for a long time. Since 1995, 2 decades ago, we've had in place national health insurance, which provides coverage for everybody in the country and access to quite a broad benefits package, but there were some important limitations. Until recently, things like dental care and mental health care were not included, and over the last few years, the government has taken steps to add access to mental health care as a right for every citizen in Israel, and also dental care for more and more cohorts of children.
Now, are they doing anything to monitor or evaluate these reforms to make sure they're actually going to work?
Oh, absolutely. The people moving the reforms are very committed to mid-course corrections, to having information available so they can see how things are going. In fact, we at Brookdale are playing an important part in these evaluations, both with regard to the mental health reform and the dental reform.
There has to be some challenges or problems that still need to come about, even though it sounds like a great healthcare system.
Oh, there are plenty of challenges. A lot of them have to do with hospital care. We have long waiting times. We don't have enough beds. Staffing ratios are not high enough, so the nurses and doctors don't really have enough time to really talk to the patients and listen enough. That's one big area which needs improvement. Another area is inequalities. Well, everybody has access, and everybody has basic access. But still, if you live in the center of the country, you have better access to a broader range of specialties than in the peripheral regions. Rich people are still getting better care than poor people. There's still important gaps between Arabs and Jews. There's work on those things, and it's becoming increasingly a focus of policymakers to try to make a difference on those as well.
Now, this is a pretty comprehensive report that you and Ruth wrote. You didn't do it all alone, did you?
Oh, absolutely not. The report has over 20 chapters on things ranging from dental care to care of the elderly to emergency room care. And with each of those chapters, we identified an expert in the health system in Israel on that particular topic and worked with them on that chapter. There's no way we could have done it otherwise.
And now that it's out, what happens to the book?
Well, there are two important things happening. First of all, Ruth is making sure that the book is constantly updated. Every time there's a new development in Israeli healthcare, she writes up a little report which goes on the website to keep things current. In addition, it's already being used. Professors are using it as a resource for their students. Professionals in the health system who maybe know emergency care really well but don't know what's happening in long-term care use it themselves. And of course, when we have senior visitors from abroad, whether from the World Health Organization or the observatory coming to provide advice to Israel, they will use this as the book to get them up to speed so they can be helpful.
Well, thank you so much, Bruce. Really appreciate this. I learned a lot today. Join us for other discussions on Brookdale research, and if you're interested in finding out more about this particular resource, check us out at the MJB website.
Thank you.